Hi everyone. Did you know that 1 person in 6 in the world lives with some form of disability? If not, let's talk about it in the context of climate change and health. My name is Muriel Mac-Seing and I'm an assistant professor of global health at the School of Public Health and a researcher at the Research Center in Public Health of the Université de Montréal. I also lead a lab called Solidarité Global Health. For the past few years, I've been working on disability, intersectional health equity, and sexual and reproductive health within the field of global health. Given my research focus on equity considerations for people with disabilities, I can no longer overlook the importance of climate change in my global health equity research, given its rapidly growing impact on the health of population groups in situations of vulnerability. Climate change is a powerful structural driver with multifaceted effects on population health and health inequities. It threatens the right to health of people with disabilities, while it also affects the resilience of health systems and infrastructures. Despite representing 1.3 billion people in the world, people with disabilities remain invisible in the global and national responses to health crises, as observed during the COVID-19 pandemic and the current climate change response. To address this serious blind spot in global and public health research, my leadership project aims to recenter the realities of people with disabilities in the context of climate-related access to health services and advance health equity-focused research for people with disabilities, employing a critical intersectional perspective. Initially, I envisioned a single key initiative to achieve this goal, more than I could handle. However, throughout the past year, I realized the importance of being strategic and building a solid foundation patiently and enthusiastically. This involved initiating several smaller offshoot projects while remaining true to my vision of inclusivity for impactful long-term change. First, a colleague, a master's student, and I, we developed a podcast featuring 2 women with disabilities, 1 immigrant single mom, and 2 humanitarian service providers. From their experience dealing with climate-related displacement during events like heat waves, wildfires, ice storms, or floods, we learned that while disaster preparedness programs are intentionally designed to evacuate affected populations, they often overlook the needs of people in situations of marginalization with inaccessible services and information to new immigrants and people with different disabilities. Second, with federal summer grant funding, I launched a project examining health services for people with disabilities and climate change in Quebec, Canada, and northern Uganda using the One Health and intersectional approaches. Partnering with 2 local organizations of people with disabilities, early findings reveal climate-related events impact both the mental health and the physical health of people with disabilities and the physical health of their animals. These results underscore the need for more intersectoral collaboration between human health, animal health, and climate sectors, supported by a scoping review conducted with 2 graduate students. Third, with MSc students that I supervised, we found that while civil society experts and practitioners in Canada, Sub-Saharan Africa, and Asia recognize the importance of addressing climate change and access to health services such as sexual and reproductive health services for people with disabilities, operationalizing this remains challenging. Barriers include ableist policies, lack of prioritization of disability rights, intersectional discrimination, and a need for evidence-based guidance to create more inclusive and equitable programs. So what's next? The WomenLift Health leadership journey taught me that achieving inclusive, impactful change requires authenticity, courage, stamina, and strategic leadership. With 2 organization partners, 6 graduate research assistants, and interns, we've shared our project findings with researchers, practitioners, and decision makers in different fora to highlight the intersection of inclusive equity, health access, and climate change, and also to inspire action. We will soon present our Quebec Northern Uganda study findings, further gather feedback to shape future research priorities, and share our scoping review at the Climate Focus Conference. Additionally, along with another specialist on disability rights and climate change, I've been invited to guide municipal public health authorities on including people with disabilities in climate-related responses. The year ahead indeed looks promising as I build collaborations and pursue new grants. Finally, I'd like to sincerely thank the whole team of WomenLift Health, all mentors and coaches, my mentoring group, the members and trainees of my lab, my colleagues, my nominator, my application sponsor, and the senior leaders at my institution. Merci beaucoup.